Yes, start ka.
சரி ஸ்டார்ட் பண்றேன்.
Yeah.
Good evening, everybody. Today we can discuss about the upper limb osteology. Okay, so I am Dr. Edal. So we can rush off the osteology things. So we all already have studied about osteology bones. So osteology of upper limb, it is very easiest thing. And so first we are going for the first bone of that osteology, that is clavicle. Okay. So unlike other bones, clavicle has some peculiar features. The first one is about ossification of clavicle. So this clavicle is the first bone in our body to ossify. So all the bones usually it will ossify around 8th week. So this clavicle is the first bone will ossify around 6th week. And this is the only long bone placed horizontally. Except its medial end, it ossify in membrane. Okay, so all of the long bone, it ossify in cartilage, except this clavicle, it ossify in the clavicle is the only bone, it ossify in membrane. So next one is, it has two primary center. So no other bone in our body has two primary center, but clavicle, it has two primary center. And it also has one secondary center. So next one, it is a subcutaneous bone. Okay, so you can touch and feel our clavicle. Next one, this bone has no medullary cavity. And the last one is, it is occasionally pierced by a nerve, that is middle supraclavicular nerve. So these are the peculiar feature of clavicle. And so this is a otherwise called as collar bone or beauty bone. So first we can talk about the ossification of the clavicle. So already we have discussed that the clavicle bone, it has two primary center. So two primary center, it will form in the shaft. Okay. So the appearance is 5th to 6th week of intrauterine life. And when it fuses around 45th day. And second one, so the secondary center, if we have only one secondary center, usually it appears in the medial end. It appears in 15 to 17 year and fuses at 21 to 22 years. So occasionally there will be extra secondary center. If it appears, it will be appearing in the acromial end. So this is about the ossification of clavicle. So now we are going to talk about the features, the external features of clavicle. And along with that, we can see the muscle attached in this clavicle. So parallelly, in this tabular column, we can see both the things parallelly. So first, already we said that clavicle, it is a only long bone placed horizontally. So automatically, this clavicle should have ends and it should have a shaft because it is a long bone. So we have, what is that, the medial end, lateral end, because it is horizontally placed. Okay. So first we can talk about shaft. So this shaft is divided into lateral 1/3 and medial 2/3 because this is placed horizontally. So this division is because of easy way of study. Okay. So for our easy or convenient study, we are dividing the clavicle into lateral 1/3 and medial 2/3. So first we can talk about lateral 1/3 of the clavicle. So this lateral 1/3 of the shaft of the clavicle, it is flat from above downwards, so that it has two borders and two surfaces. Okay. So what are the borders? The first one, it is the anterior border and it has a posterior border. Okay. So anterior border, to see, it is concave, and posterior one is convex backwards. So next we can talk about surfaces. So it has two surfaces, one is superior surface and inferior surface. So you can see in this tabular column, superior surface is subcutaneous. We can touch and feel near our skin. Okay, so it is very subcutaneous surface. And inferior surface, it has two elevation in it. One is conoid tubercle and other one is trapezoid ridge. So inferior surface of lateral part has two elevations. One is conoid, other one is trapezoid ridge. Okay. So next we are going for medial two-third. The medial two-third, it is rounded part of the shaft, and so it has no borders and it has only four surfaces. Okay. So what are the four surfaces? One is the anterior surface, posterior surface, superior surface, and inferior surface. Anterior surface, it is convex forwards. Posterior surface, it is smoother, and then superior surface, it is rougher. Inferior surface, so this inferior surface has two features. What are the two features present in the inferior surface of medial part of the shaft? One is oval impression. So this oval impression is for what? For articulation with the first costal cartilage. Okay. So first rib will be articulating with the clavicle. So this oval impression for the first rib. Second one, this medial inferior surface, it has a subclavian groove. So this subclavian groove is located lateral part of the inferior surface. Okay, lateral half. Okay, so this subclavian groove, it is present in the lateral half of this inferior surface. So next we are going to talk about the muscle attached along with this features. Okay. So first we can go for that is lateral one third. What are the muscles attached? So in lateral one third, we have only two muscles attached. That is anterior part. We can see the deltoid muscle. So parallelly you can see. So I have represented the origin muscle in a red color and insertion muscle in blue color. Okay. So anterior border gives origin for a deltoid muscle, and posterior border, it gives insertion for a trapezius muscle. Okay. Now we are coming to the medial two-third. Medial two-third gives attachment for four muscles. Okay. So three muscles are originating and one muscle is inserted. So four surfaces gives attachment for four muscles. So anterior surface gives origin for pectoralis muscle, major muscle, and the posterior surface, it gives origin for a muscle called a sternocleidoid muscle. The sternocleidoid muscle, it is one of the strap muscle or infrahyoid muscle. Okay. And next you are coming for superior surface. Superior surface, it gives attachment for clavicular head of sternocleidomastoid muscle. Okay. And then now we are coming for inferior surface. Inferior surface, already we saw it has a subclavian groove, and this subclavian groove gives attachment for a muscle, that is insertion for a muscle called a subclavius muscle. Okay. So totally we can see the shaft gives attachment for six muscles. So next we are coming for ends of this clavicle. Okay. So already we saw it is horizontally placed bone, so that it has lateral end and medial end. So lateral end is otherwise called as acromial end because this lateral end articulates with the acromion process of scapula. Okay. And medial end is otherwise called as sternal end because it articulates with the sternum. First, we can talk about the lateral end. So lateral end, again, it seems to be flat. Okay, from above downwards, it articulates with the acromion process, and it makes a joint called as acromioclavicular joint. So next one is medial end. It is quadrangular, and this will articulate with the manubrium sterni. Okay, and it forms a joint called as sternoclavicular joint. It also articulates inferiorly with the first costal cartilage. Okay, so this is about the features of the end. Okay, so both the end will articulate with the two bones to make a joint, that is acromioclavicular joint, and the other one is sternoclavicular joint, and it also articulates with the first costal cartilage. So it articulates with three bones nearby, three bones. Okay, and when you come to the muscle attachment, this ends, it doesn't give attachment for muscle. So shaft gives attachment for six muscles, and ends, it doesn't give attachment for muscles. It will give attachment for a ligaments. Okay. So in this picture, we can see the features of the clavicle. So we all have seen already the clavicle. So with the bone, usually there is a rule, the osteology should be studied with the bone. So it will be very easy to understand. So because this online class, we can see through the pictures. So when you study this osteology, please study with the bones, and please have a reference of atlas when you study osteology. Okay. So this picture shows the muscle attachment. Okay, so blue color, we can in the first picture we can see the attachment of anterior laterally, we can see deltoid muscle, and posteriorly, so we can see the trapezius muscle. So here the medially we can see pectoralis major muscle, and superiorly we can see sternocleidomastoid muscle. So these are the pictures we can see in this. These are the muscles we can see in this. So next we can talk about the ligaments attached in this clavicle. Okay. So what are the ligaments attached in clavicle? So first ligament is, so in this picture, in this tabular column, so parallelly I have shown you the features and the ligaments attached. So please see under the ligament. So the first ligament attached is conoid and trapezoid part of coracoclavicular ligament. So this is the first ligament present in the clavicle. Where it is attached in the inferior surface of the lateral one third of the shaft. Okay, so already we have seen the inferior surface of lateral one third of the shaft. It has two elevation. One is conoid tubercle and other one is trapezoid ridge. So these two elevation gives attachment for a ligament called as coracoclavicular ligament. So this is the first ligament. Second, we are coming for second ligament. Please trace it out below in this ligament column. Second ligament is costoclavicular ligament. Okay, so name itself says, so it attaches with the rib, first rib. Okay, so the costoclavicular ligament connects the clavicle and the first rib. So where it is attached, just see in the left side along parallel with the ligament. Please see in the left side, you can see. So it attaches to the rough oval impression present in the inferior surface of the medial two-third of the shaft. So when you study, so you can study in this manner, so it will be very easy to revise or to keep in your memory. Okay, so parallelly if you study, it will be very easy. So next one, the third one is the clavipectoral fascia. So the clavipectoral fascia, it is attached in the subclavian groove. Okay, so subclavian groove gives attachment for a muscle, that is subclavius muscle, and also it gives attachment for a fascia called as clavipectoral fascia. Okay, because the subclavius muscle is fully covered or wrapped by a muscle, that is clavipectoral fascia. Okay, so these are the structure coming in the shaft region. So next we can talk about the end region, the end of the clavicle. So usually, so wherever you're seeing joint, if it is a synovial joint, so automatically the synovial joint is covered by the joint capsule or fibrous capsule. Okay, so synovial joint means it should cover with the fibrous capsule or joint capsule. So here the acromial end and the sternal end both are a synovial joint. Okay, so acromioclavicular joint is a synovial joint and sternoclavicular joint is again a synovial joint. So that automatically both the end gives connection or it gives attachment for a joint capsule. Okay, so lateral end it gives attachment for joint capsule and medial end also it gives attachment for joint capsule. Otherwise you can say that is the fibrous capsule. Okay, so apart from that, the medial end also gives attachment for some other structure. What are these structure? So it also gives attachment for the articular disc. So where it is attached postero-superiorly. Please see in this tabular column, you can see one by one. The first one is joint capsule. Second one is articular disc. Where it is attached in postero-superior part. And next one is the medial end also. Both the clavicle are connected by a ligament called as interclavicular ligament. Okay. So both the medial end of clavicle is connected by a interclavicular ligament. Where it is attached in the superior part of the medial end of the clavicle. Okay. So these are the ligaments attached in the clavicle. Okay. So next you are going for the clinical anatomy of clavicle. So clavicle is usually prone for fracture. So the junction between two curvatures, that is lateral 1/3 and medial 2/3, it is more prone for, it is the weakest point, so it is more prone for fracture. Okay, so the junction between two curvatures is weakest point. Second one is a common site of fracture, and third one, if there is a fracture, if fracture occurs, the lateral fragment of clavicle, it will displace because of weight of upper limb. Okay, so next one is cleidocranial dysostosis. So what is cleidocranial dysostosis? So in some condition, it's a congenital anomaly. Okay, in some condition, the baby will born with this condition. So that is, in this condition, we can see absence of clavicle. The baby will born without clavicle. This condition is called as cleidocranial dysostosis. This comes under congenital anomaly. Okay. So you can see it in this picture. This is a common site of fracture of clavicle. So this is a cleidocranial dysostosis condition. So next we can talk about the second bone, that is scapula, very easiest bone, and this comes under flat bone. Okay, so first we can discuss about the ossification. So the scapula, it has one primary center and 7 secondary center. So one primary center, it appears near the glenoid cavity, and so when it appears as usual, already I have said, all the bones, the primary center will appear around 8th week of intrauterine life, okay, except clavicle. And when it fuses around 45th day. And next we can talk about secondary centers. Total we have 7 secondary centers. So one by one we can see. Okay, so first one is the first secondary center. It will appear in middle of coracoid process. Okay, so when it appears in the first year. Okay, and it fuses in the 15th year. Second one, subcoracoid center. Subcoracoid center, it appears at the around the root of coracoid process. So when it appears in 10th year and it fuses in 16 to 18 year. And the remaining centers for 2 for acromion and 1 for lower 2/3 of margin of glenoid cavity and 1 for medial border of scapula and 1 for inferior angle. Okay, so these are the remaining secondary centers, and all these remaining secondary center will appear during puberty and it will fuse around 25th year. Okay, so next we are going to talk about the surfaces, external features of scapula, and along with that parallelly we can see the muscle attached to this features. Okay, very easiest bone to study, and we can easily recall the structures. So first we can talk about surfaces. How many surfaces are there in the scapula? So first one is costal surface. There are totally 2 surfaces. One is costal surface, one is dorsal surface. Okay. So next one is, it has 3 borders. Okay. So what are the 3 borders? Superior border, lateral border, and medial border. And next one is 3 angles: superior angle, inferior angle, and the lateral angle. So very easy to study. Border is 3, angle is 3, and processes will be studying processes also. It is also 3. Okay, so 3, 3, 3. So first we can talk about surfaces. So costal surface. So in this costal surface, there is again a depressed area called a subscapular fossa. Okay. So next we are coming for dorsal surface. So this dorsal surface is not plain. Okay. So here you can see a self-like projection. So this self-like projection is called as spine of scapula. So this spine of scapula, which divide the dorsal surface into 2 fossa. Okay. Above the spine, it is called as supraspinous fossa, and below the spine, it is called as infraspinous fossa. So when you come to the fossas, we got 3 fossas. One is subscapular fossa, supraspinous fossa, and infraspinous fossa. So now we got 3 borders, 3 angles, 3 surface. What's it? 3 processes. Now 3 fossas. Okay. So now we are coming for the notch. There is one notch called a spinoglenoid notch. What is a spinoglenoid notch? So this is a notch which connect both the fossa, supraspinous fossa and infraspinous fossa is connected or channeled by a notch called a spinoglenoid notch. So now we are coming for borders. Superior border of scapula, it is very thin and it is very short. And this is not continuous. It also has a notch in it. And the name of the notch, so as the structure says, it is called a suprascapular notch. Okay. So next one is lateral border. It is thicker and medial border, it is thinner. Okay. So now here the glenoid cavity, above the glenoid cavity and below the glenoid cavity, we can see two tubercles. So in this picture, in this tabular column, you can see just below that. So there are two tubercles. One is infraglenoid tubercle, supraglenoid tubercle. Okay, one is above, one is below. According to the location, we are naming the tubercle. So supra and infra. Next one is angle, superior angle, inferior angle, and lateral angle. Lateral angle is otherwise called as glenoid angle. So over the lateral angle, we have a fossa. So it is otherwise called as glenoid angle. The name of the fossa is glenoid fossa. Okay. So parallelly, we can see muscle attachment in this region. Okay, surface in a muscle. What are the muscle attached in the surfaces, and what are the muscle attached in the borders, and what are the muscle attached in the angles. Okay. So first we can go for the muscles attached in the surfaces. So already we saw surface, costal surface has a fossa called as subscapular fossa. Here it gives origin for a muscle called as subscapularis muscle. Okay, so fossa and muscle have similar term. Okay? So next we are coming for dorsal surface has two fossa, supraspinous fossa, infraspinous fossa. Supraspinous fossa it gives origin for a muscle called as supraspinatus. And infraspinous fossa it gives origin for a muscle called as infraspinatus. Okay, now we are coming for borders. So superior border. So superior border, we have suprascapular notch, isn't it? So near to this notch, we can see origin for a muscle called as inferior belly of omohyoid. It is one of the strap muscle which is coming in the neck region. Okay. So next you are coming for lateral border. So lateral border, it is thicker border and it gives attachment for teres minor muscle, that is origin. So lateral border, it gives origin for your muscles. Okay. So what are the muscles originated in the lateral border? Teres minor, and where it is attached in the upper two-third. And next muscle is teres major. Teres major, it will be attached in the lower one-third. Okay. So lateral border gives attachment for both minor and major teres muscles. So next we are coming for medial border. So medial, whatever muscle is it is attached in the medial border, all those muscles are inserted. Okay, so you can see the color representation. So medial border of scapula gives insertion of all the muscles. Okay, what are the muscles we are going to see? So first muscle, it is a serratus anterior. So where it is inserted in the medial border? So it is inserted in the costal surface of the medial border. So entire costal surface of medial border, the serratus anterior muscle is inserted. Okay. So now we can turn the scapula. We can turn the scapula. We are coming for dorsal region. Okay. So costal region, only one muscle throughout the length called as serratus anterior muscle. It is inserted. Now we are coming for dorsal region. So here the first muscle inserted is levator scapulae. Okay. So where it is inserted from the superior angle to the root of spine. So already we have seen the dorsal surface of the scapula. It is not flat or plain. It is divided by a shelf-like projection. So above the shelf in the medial border, we can see the first muscle, that is levator scapula. Superior angle to the root of spine, we can see the levator scapula. So please, when during my class, if you see the picture, it will be easy for you to understand. Please see the medial border of scapula. Okay. So second one is rhomboid minor, where it is attached from the root of spine or opposite to the root of spine. Okay. So just opposite to root of spine, we can see the muscle called as rhomboid minor. And next muscle below the root of spine till the inferior angle, we can see rhomboid major is inserted. So medial border, it gives insertion for, so how many muscles? So dorsally 3 muscle and costally we have only 1 muscle. Okay, serratus anterior costally, dorsally levator scapulae, rhomboid minor, rhomboid major. So next we are coming for infraglenoid tubercle and supraglenoid tubercle. Okay, so supraglenoid tubercle gives origin for a muscle called as long head of biceps, and infraglenoid tubercle gives the origin for a muscle called as long head of triceps. Very easy to keep in our memory. Okay, so both are long head, above is biceps, below is triceps. Okay, supraglenoid tubercle, biceps can be seen below, infraglenoid tubercle, triceps can be seen. Both are long head. Okay, angles. So in this angle, the muscle is not origin or inserted. Instead, the angle is covered by the muscle. Okay, so superior angle it is covered by trapezius muscle, inferior angle it is covered by latissimus dorsi muscle. So now we can go for processes. So as already I said, there are 3 processes. What are the 3 processes? Acromion process, spinous process, coracoid process. So acromion process, we have 2 borders. So what are the 2 borders? So medial border and lateral border. Spinous process has 3 borders. So what are the 3 borders? So the spinous process, we have a upper border, lower border, and the posterior border. So posterior border, it is otherwise called as crest of spine. Okay, crest of spine. So if you have the bone, you can see that, or if you have picture, you can see the picture. So it will be easy to understand. So there is no importance in the upper and lower. So there is more important in the posterior border, otherwise called as crestospinous process. Okay, so this crest has 2 lips. Okay, so crest has 2 lips. One is upper lip, one is lower lip. Okay, and it also has 2 surfaces. Okay, so now we are coming for the surfaces. One is superior surface and other one is inferior surface. Okay, so spinous process, posterior border has upper lip, lower lip. It also has 2 surfaces, superior surface, inferior surface. Now we can see coracoid process. So third process is beak-like process, that is called as coracoid process. So it comes under the type atavistic type of epiphysis. Why? Because it's during evolution, before it is a single bone, during evolution it will fuse with the other bone and it forms a it will attach with the scapula, and it comes under the scapula. So it is called as atavistic type of epiphysis. Means in lower animals it is a separate bone. In higher animals, that is human being, it is a combined bone, combined with the other bone. So it comes under the type called as atavistic type of epiphysis. Okay, it is an important question. Coracoid process it comes under atavistic type of epiphysis. So coracoid process has mainly two features. One is it has a tip, okay, and the other one it has a superior surface. Okay, so these are the features can be seen in the process. So we are studying these process features in this process because so all these features gives attachment for muscles. Okay, so acromion process it has 2 borders, that's all. Spinous process it has 3 borders and 2 surfaces. And coracoid process it has tip and the superior surface. Okay, so now we are coming for muscle attachment along with the features. So acromion process, the medial border gives insertion for a muscle called as trapezius, and lateral border it gives origin for a muscle called as deltoid. Okay, so we all know deltoid muscle. It has a peculiar muscle. It has a what is that? It is a triangular shaped muscle. It has anterior fibers, posterior fibers, and lateral fibers. So this acromion process gives origin for the lateral fibers of deltoid, and this type of fibers it is called as multipennate fibers. Okay, multipennate muscle. Okay, so this area acromion process gives origin for the multipennate part of the deltoid muscle. Clear? Okay. So now we are coming for spinous process muscle attachment. So here the upper lip of the crest gives insertion for trapezius muscle and lower lip gives origin for deltoid muscle. So when you see the acromion process and spinous process, when you compare both the process, so the medial and lateral, the medial border of the acromion process will continue along with the upper lip of the spinous process, and lateral border will continue with the lower lip of the spinous process. Okay, both are a continuation. Those are the bone, you can trace it out. So you can see the continuation of acromion process with the spinous process. Okay, so both you can compare it and you can see it. Okay, so now you can see the coracoid process muscle attached. So coracoid process, there are three muscles attached. So first one is tip gives attachment. Lateral to the tip, you can see the short head of biceps brachii. Okay, so it is originated, and medially we can see coracobrachialis. Usually both the muscles will be called as a twin muscle because they both will travel together. Short head of biceps brachii and coracobrachialis. Both will travel together, so it is called as twin muscle. Okay, so both are originated in the tip of the coracoid process. So next we are coming from superior surface of coracoid process. The superior surface of coracoid process gives insertion of a muscle called as pectoralis minor. Pectoralis minor. So overall, the processes gives origin for the five muscles. Okay, trapezius, deltoid, short head of biceps, and coracobrachialis, and pectoralis minor. Whenever you're talking about short head of biceps, automatically you can see another muscle coming nearby, that is coracobrachialis. Always both the muscle travel together. So the discussion of coracobrachialis, there is a need to discuss about the short head of biceps. Okay. So next, so this is a picture of the scapula. You can see the features. Okay, so you can see the surfaces, you can see the borders, you can see the angles, and you can see the processes. Okay, and now you can see the muscle attached. So you can see our fossa, subscapular fossa, glenoid fossa, and next you can see the processes here: coracoid process, acromion process. Okay, so posterior part or dorsal part, you can see supraspinatus fossa, infraspinatus fossa, glenoid fossa, acromion, and the coracoid process. Okay, so here you can see the muscle attached. So now you can come in for the ligaments attached. What are the ligaments attached in the scapula? So again, I have this tabular column. You can see the features parallelly. You can see the ligament. So first ligament to attach, it is spinoglenoid ligament. Where it is attached, so we can see left side, it is attached in the spinoglenoid notch. So what is spinoglenoid notch? Already we have seen the supraspinous fossa and infraspinous fossa both are connected by a notch called as spinoglenoid notch. And this notch, it is connected, it is bridged by a ligament called as spinoglenoid ligament. So here, very, very simple to remember. So the notch and the ligament has same name. Second one is transverse ligament, where it is attached. So you have come to the left side. So you can see there is a notch called a suprascapular notch. So suprascapular notch, it is bridged or it is connected by a ligament called as transverse ligament. So next we are coming for again the angles. So angle we can see the glenoid fossa, isn't it? The lateral angle bears a glenoid fossa. So this fossa is for articulation with the head of the humerus, isn't it? It makes a joint. So automatically, so we have a joint here, and this joint is a synovial joint, and so there is a need of a ligament called as joint capsule or fibrous capsule. So here the ligament attaches joint capsule, and already we know that what is that glenoid fossa, it is very shallow and the head is larger, isn't it? So to accommodate the larger head, the glenoid fossa should become deeper, isn't it? So this deepening is formed by a structure called as glenoid labrum, isn't it? Band-like structure. So this glenoid labrum is attached to the glenoid fossa. So glenoid fossa gives attachment for two structures: joint capsule, glenoid labrum. So next we are coming for the processes attachment. So here the medial part of acromion process, it has a facet, And this facet, it gives attachment for a capsule, joint capsule. So for what? For a joint. It makes a joint there. What is the name of the joint? Acromioclavicular joint. Because acromion process will articulate with the nearby bone, that is clavicle. So to form a joint called as acromioclavicular joint. So this capsule is attached here. Okay. So it is attached in the medial part of the acromion process. So now we are coming for the coracoid process. The coracoid process, it gives attachment for three ligaments. First one is coracoacromion ligament. Second one is coracohumeral ligament. Third one is coracoclavicular ligament. Okay, so three ligaments are attached in the coracoid process. So now we are coming for the clinical anatomy of scapula. So very, very, very important clinical anatomy in scapula. It is winging of scapula. Winging of scapula, it occurs because of paralysis of serratus anterior. How it appear? How this paralysis occurs? The paralysis occurs because of injury to the nerve supplying the serratus anterior. So we all know that we have a nerve supplies the serratus anterior, that is nerve to serratus anterior or nerve of Bell, isn't it? Or long thoracic nerve. So if it is injured, it will lead to paralysis of serratus anterior. This condition is called as winging of scapula. Okay, and in this condition, we can see very prominent medial border of scapula. And if the person is having a winging of scapula, the person cannot abduct his arm beyond 90 degrees. Okay, so the abduction is not at all possible beyond 90 degrees. Okay, so next one. So again, congenital anomaly of scapula, that is scaphoid scapula. What is scaphoid scapula? Again, in the medial border. So medial border of scapula, it is not completely formed, and you can see concave shaped medial border of scapula. Okay, so these are the important clinical anatomy in this scapula. So next we are coming for the picture. Can you see in this picture, the left side, A, we can see the paralysis of serratus anterior showing the winging of scapula. Okay, so in B, it is a normal part. So this is about the winging of scapula. So this occurs because of the injury to the long thoracic nerve or nerve to serratus anterior or nerve of Bell. So now we are coming for the third bone, that was called as humerus. Okay. So first again, ossification of humerus. So it again has one primary center. Okay. So where it appears, so it is a long bone. Again, this is a long bone, isn't it? So this long bone, the primary center appears in the middle of diaphysis. Diaphysis is nothing but it's the shaft, isn't it? Middle of the shaft. The primary center appears in the shaft. Okay. So when it appears around the 8th week of intrauterine. Blindly we can write for all the primary center 8th week of intrauterine except clavicle. Okay. And second one is secondary centers. How many secondary centers? 7 secondary centers. Okay. So first one, pre-secondary center for upper end. Okay. So upper end will be formed from the 3 secondary centers. So for what? First one is for head, second one is for greater tubercle, and next for the lesser tubercle. Okay. So head, the secondary center for head appears the first year, secondary center for greater tubercle appear in the second year, secondary center for lesser tubercle appear in the 5th year. Okay. And when it fuse, so all these together fuse in the 6th year. Okay, so it will fuse together in the 6th year, and it again fuses along with the shaft during 20th year. Okay, now we are coming for the remaining centers. So remaining 4 secondary center for the lower end. So one for capitulum, okay, and lateral flange of trochlea. Okay, so for both structure, one secondary center, and second one is for medial flange of trochlea, one for lateral epicondyle, one for medial epicondyle. So totally 4 for lower end of secondary, lower end of the humerus. One for capitulum and lateral flange of trochlea, one for medial flange of trochlea, one for lateral epicondyle, other one for medial epicondyle. So capitulum first year, medial flange of trochlea 9th year, and lateral epicondyle 12th year, and medial epicondyle for 4th to 6th year. Okay, so here the first three structures will fuse at 14th year, and it fuses to the shaft. Along with the shaft, one is very important. So medial epicondyle region is the last one to ossify. Okay, so sorry, last one to fuse. Okay, that's the growing part of the humerus. So the easiest one is you should think of the growing end of the appellum. So in the humerus, the growing end is the upper end of the humerus, and what is that? In radius and ulna, the growing end is lower end of the what is that? Lower end of radius and ulna is a growing end. Okay, so this is a term we should keep in our mind. So upper end of humerus is growing end, and lower end of radius and ulna it is a growing end. So now we are coming for the humerus. So features of humerus, very easy to understand. Okay, very simple to understand. That is, the first one is the humerus has head. Next one is neck, and below the neck we have. So in the upper end we have head, neck, then lesser tubercle, greater tubercle, and between two tubercles we have a sulcus called as intertubercular sulcus or bicipital groove. Okay, so these are the structure present in upper end: head, neck, lesser tubercle, greater tubercle, and intertubercular sulcus. That's all. Okay. So what about head? So head is a structure. So it is not a complete sphere. It is 1/3 of the sphere. Okay. So next one is neck. So there are three necks in the humerus. What are the three necks? Anatomical neck, surgical neck, morphological neck. Okay. What is anatomical neck? It is a neck which divide the head and the remaining part of the upper end. What is surgical neck? So it divides the upper end and the shaft. Okay. What is morphological neck? So this morphological neck cannot be visible. It is not visible structure, but it is present above the surgical neck. Okay. So these are the three necks present in the upper end of the humerus. So next one is lesser tubercle, greater tubercle. So in this greater tubercle, we can see three impression. Okay, so it is not an even area. Instead, we can see three impressions. One is above, so that is called as upper. Other one is middle. Other one is lower. There are three impressions. Okay. So now we are coming for intertubercular sulcus. So area both the tubercle is separated by the sulcus called as intertubercular sulcus, or it is called as a bicipital groove. Okay. So next, why it is called as bicipital groove? Through the sulcus, the tendon will be passing through. Okay. So long head of biceps will be long head of biceps tendon will be passing through. So it is called as bicipital groove. Okay. So next, intertubercular sulcus has two parts. What are the two parts? It has two lips. One is medial lip, other one is lateral lip. Okay. So these are the two parts present in this sulcus. So now we are coming for the borders of the humerus. So first one is anterior border. So what about the anterior border? So anterior border, so it is a continuation from the lateral lip of the sulcus. Okay, so lateral lip of intertubercular sulcus will continue below as the anterior border. Okay, so this anterior border in the middle is crossed by a deltoid tuberosity, and in the lower part, the anterior border, it is smoother and rounder. Okay, so this is about the anterior border. So we are dividing the anterior border into three parts: upper part, middle part, and lower part. Upper part, you can see the lateral lip of sulcus. Middle part is crossed by the anterior margin of deltoid, and lower part you can see the rounded part. Now we are coming for lateral border. So lateral border, upper part is not clear. Middle region we can see it is crossed by a radial groove, and lower part, the what is that? Lateral border continues as a lateral supracondylar ridge. Very important, because this structure gives an attachment for important structures. Okay. So next we are coming for the medial border. So medial border, it gives attachment. It extends the upper part with the medial lip of sulcus, and middle part, it what is that? The rough strip will be passing through. Okay, and the lower part we can see extend as a medial supracondylar ridge. Okay, so shaft of the humerus we have three borders: and anterior border, lateral border, and medial border. So now we are coming for the muscle attached in this upper end. Okay, so very simple and very easy to keep in our mind. There is a mnemonic that is called a sixth muscle. Okay, so SITS. So what is that? So first one is S for supraspinatus. That is greater tubercle gives the attachment for three muscles, isn't it? Upper, middle, lower part. The upper for supraspinatus, middle for infraspinatus, lower for teres minor. So SIT, sit. And last one is the lesser tubercle. It gives attachment for the next muscle called as subscapularis. So these four muscles will be together. It is called as sits muscle. S for supraspinatus, I for infraspinatus, T for teres minor, and next S for subscapularis. So all those six muscles is inserted in the upper end. Okay. So next we are coming for the intertubercular sulcus. Next one, intertubercular sulcus. So here we can see medial lip and lateral lip. So this also gives attachment for the muscle. So in the next tableau column, we'll talk about the muscle attached here. Now we are coming for the borders. So the anterior border, lateral lip. Okay, so lateral lip will be giving insertion for a muscle called as pectoralis major. Okay, so lateral lip of intertubercular sulcus, it gives insertion for a muscle called as pectoralis major. Okay, and middle part we have a deltoid tuberosity, isn't it? So deltoid tuberosity gives insertion for a muscle called as deltoid muscle. Okay, so you can see attachment parallelly, the right side and left side you can compare and see. Okay, so now we are coming from below that medial lip of sulcus. Medial lip of sulcus, we can see the muscle called as teres major muscle. Okay, so it is again inserted. And next one is that is rough strip. So rough strip in the anterior margin of deltoid tuberosity. So there is a rough strip. So this rough strip gives insertion for a muscle called as coracobrachialis. So overall, in this tabular column, you can see all those muscles which is attached in the upper part of the humerus is inserted. Okay, no muscle is originated here. So here, the first we saw sixth muscle. Okay, sixth muscle is inserted. Second, we can see lateral lip and medial lip. Okay, so lateral lip muscle, that is pectoralis major, deltoid tuberosity muscle, that is deltoid muscle. Okay, medial lip muscle is teres major. It is again inserted. Okay, lateral lip gives insertion for a muscle pectoralis major. Medial lip of intertubercular sulcus, it gives insertion for teres major. Okay, so there is one mnemonic for this, that is lady between two major. Okay, so what is the meaning of lady? Lady is nothing but latissimus darcy. You'll be seeing the next diagram, next tabular column. Okay, lady is for latissimus darcy, and two major is, one is pectoralis major and other one is teres major. Pectoralis major lateral lip, teres major medial lip. And next we are coming for the surfaces. So already we saw borders. Now there are three surfaces. Very simple to see. That is, one is anterolateral and other one is anteromedial. Because of the presence of anterior border, we have two surfaces: anterolateral, anteromedial. Okay, and other surface is posterior surface. There is no posterior border, so we have single posterior surface. If we have posterior border, again it will be divided. Okay, so automatically we have two anterior surface, one posterior surface. What are the two anterior surface? Anterolateral surface, anteromedial surface. Okay, so anterolateral surface and anteromedial surface, both the surface it gives origin for a muscle called as brachialis. So already we have seen the upper part, all those muscles inserted. Now we are coming for the first muscle which is originated. Where it is originated? So it is originated in the lower half. Okay, the anterolateral and anteromedial part, it gives origin for a muscle brachialis. Okay, so next one is floor of sulcus. So previous tabular column we saw lateral lip, and medial lip. Lateral lip pectoralis major inserted, medial lip teres major it is inserted, and in the floor we can see latissimus tarsi is inserted. Okay. So next we are coming for the posterior surface. So posterior surface, you should think of or the humerus bone. The posterior surface, it is fully, it gives attached for the single muscle called as triceps muscle. Okay. So posterior surface upper part we have a oblique ridge. Okay. So oblique ridge, it gives origin for triceps lateral head. Okay. So the name says it triceps. What is triceps? It has three heads, so it is called as triceps. Okay. So triceps, it is attached in the oblique head, and next one is below, that is radial below the oblique ridge, that is radial groove. There is a muscle called as medial head of triceps. Overall, you should keep this in your mind. Posterior surface of humerus, it gives or insert or that origin for a muscle called as triceps. Okay, upper part lateral head, lower part medial head. Okay, so above lateral, below medial, both are triceps muscle. Okay, that's all about the surfaces. So three surfaces: anterolateral surface, anteromedial surface. Both the surface, it gives origin for muscle brachialis, and posterior surface we can, it gives origin for the muscle called as triceps. Okay. Now we are coming for lower end. So lower end, it is divided into two parts. Okay. So see the features: articular parts, non-articular part. What are the articular parts? So articular parts means it articulate with the radius bone and ulnar bone below. Cap. The first articular part is capitulum, and next one is trochlea. Okay. So capitulum, it will be articulating with the head of radius. Second one is trochlea. Trochlea means fully shaped. It articulates with the trochlea notch of ulna. Okay. And this trochlea, it has medial part and lateral part. Medial edge is it is elongated. It projects 6 millimeter than the lateral edge. That is a peculiarity about the trochlea. Okay, so trochlea itself present medially. The medial part of the trochlea, it is again projected. Okay, so how it projected? It projected 6 millimeter below. Okay, so this is the reason for the carrying angle. We have seen carrying angle. So the carrying angle is because of this projection of medial edge. Okay, how it projected? It is projected 6 millimeter below than the lateral edge. Okay, so now we are coming for non-articular parts. What are the non-articular parts? So it has a epicondyle. Or how many epicondyle? Medial epicondyle, lateral epicondyle. Okay, and it also has two supracondylar ridge. Lateral side, it is called as lateral supracondylar ridge. Medial side, it is medial supracondylar ridge. Okay, so these are the non-articular parts, and it has two fossas. What are the two fossas? So below the supracondylar ridge, you can see it has coronoid fossa, radial fossa. Where it is present, coronoid fossa is present above the trochlea, and radial fossa, it is present above the capitulum. Okay. So next one is olecranon fossa. So olecranon fossa, it is present posteriorly. Okay. So above the trochlea, and it is present posteriorly. So anteriorly two fossa, one is coronoid fossa, other one is radial fossa. Posteriorly one fossa called as olecranon fossa. Okay. So these are the non-articular parts: epicondyle, supracondylar ridge, and the fossa. Okay. So parallelly, we can talk about the muscles attached in the lower end. So what are the muscles attached in the lower end? When you think of epicondyle, medial epicondyle, think of muscles. Okay, so you can compare here left side and right side. So just parallel to the medial epicondyle, you can see it gives origin for the muscle called as forearm superficial flexor muscle. Otherwise, you can see superficial flexor muscles of forearm. Okay, whatever muscles, flexor muscles of forearm is present, superficial muscle is present, all have a common origin, that is epicondyle, medial epicondyle. Okay, so we all know forearm has two set of muscles. One is flexor muscle, other one is extensor muscle. So we have flexor also, it is again divided into superficial muscle and deep muscle, isn't it? So there are 5 superficial muscles. All those 5 muscles, it will be originating from the medial epicondyle region. Okay, so next we are coming for lateral epicondyle of the humerus. So this lateral epicondyle has two parts, anterior part and posterior part. The anterior part of lateral epicondyle, again it gives origin for extensor muscles of forearm. Okay, extensor muscles of forearm, that again superficial muscles. Okay, so both the epicondyle gives the origin for superficial muscles, and medial epicondyle gives origin for flexor muscle. Lateral epicondyle gives origin for extensor muscle. Okay, both are common origin. Okay, so there is no need to study specific muscles. You can say in single word, medial epicondyle, superficial flexor muscles of forearm, lateral epicondyle, superficial extensor muscles of forearm. Okay, so again, posterior part of the lateral epicondyle gives as origin for a separate muscle that is called as anconeus muscle. Okay, anteriorly set of muscle is originating, posteriorly single muscle is originating. The name of the muscle is anconeus, which is again a extensor muscles of forearm. Okay, so next we are coming for supracondylar ridges. So first one is lateral supracondylar ridge. So lateral supracondylar ridge gives attachment for two muscles. Okay, so what are the two muscles? Upper part, upper two-third gives origin for a muscle called as brachioradialis, and lower one-third it gives origin for a muscle called as extensor carpi radialis longus. Extensor carpi radialis longus. Okay, so lateral part it gives origin for two muscles. So next we are coming for medial supracondylar ridge. So medial supracondylar ridge, it gives origin for single muscle called as pronata teres. Pronata teres. Where it is originated, it is originated in the lower one third. Okay. So you can see in this tabular column, whatever muscle it is attached in the lower end, all the muscle are originating. No muscle is inserted there. Okay. So next we are coming for fossa. Fossa directly muscle is bone is attached, so no muscle attachment. So next you can see in this picture. So in this picture we can see the upper end of the humerus. So you can see greater tubercle. Lesser tubercle always faces anteriorly. Greater tubercle faces laterally, and between both the tubercle you can see the tubercular cells. Okay, so you can see anatomical neck in this picture. Okay. Surgical neck is nothing but the neck constricted area between the upper end and the shaft. Okay. So these diagrams, because of lack of time, we can skip these diagrams. So you can see in your books or you can study with your boards. So next here we can talk about the ligaments attached. There are only two ligaments. Very simple to study. Okay, only two ligaments. So upper end, that is neck region, it gives attachment for a ligament, capsular ligament of shoulder joint. Because what is that? We already know. So the shoulder joint is again a synovial joint. So it is covered by the capsular ligament or fibrous capsule. So use attachment for capsular ligament. That's all. The next one, lower end, capitulum and trochlea. Above the capitulum, above the trochlea, you can see it gives attachment for the capsular ligament of elbow joint, because the elbow joint is again a synovial joint. Okay, so very simple. Only the capsular ligament is attached in this humerus. So what about the anatomy? So here we can see this two bones is directly related with three nerves. Okay, if there is any fracture of the humerus, it will directly injure these three nerves. What are the three nerves related with the humerus? First one is axillary nerve. Okay, so axillary nerve lies around the neck of that surgical neck of the humerus. Okay, second one is radial nerve, where it lies at the radial group. Okay, third one is ulnar nerve, it lies behind the medial epicondyle. So next one is, so the common site for fractures. What are the common site of fracture of humerus? So first one is supracondylar fracture. Above the condylar region, the bone is prone for fracture. So this fracture may injure the median nerve, and it also lead to Volkmann ischemic contracture. It will affect the brachial artery, and finally it leads to Volkmann ischemic contracture. And again, inferior dislocation of head of humerus is also more common. So these are the clinical part in the humerus. Okay. So next we are going for radius bone. So radius bone, first one we can talk about the ossification. Okay. So ossification, it has one primary center, and again this primary center appears because it is a long bone. The first primary center, it appears in the shaft, isn't it? And when it appears in the 8th week of intrauterine life. And what about the secondary center? There are two secondary center, one for lower end and one for upper end. So lower end here it appears the first year, and the for upper end it appears in the 4th year. Okay, so when it fuses first year, it will fuse in the 20th year, and the lower upper end it fuses in the 18th year. Okay, so next we are coming for the features. So what are the features related with the humerus? So the first one, again, it is long bone, so it has to end upper end, lower end, and the shaft. So first we can talk about the upper end. Okay, so the radius bone has a disc-shaped head. Again, below the head there is a constructed area called as neck, and below the neck there is a tuberosity. So anterior part of the tuberosity is smooth, posteriorly it is rough. Okay, very simple 3 points in the upper end of radius. Second one we can go for shaft. So shaft of the radius. So shaft, it has three borders. What are the three borders? Anterior border, and medial border. Anterior border, it has a upper part, anterior oblique line, and lower part it is vertical and crest line. Anterior border, upper part is oblique and lower part it is vertical. And then posterior border. So posterior border, again it is a anterior border. So it has again posterior oblique. Upper part is a oblique line and lower part is vertical and crest line. So anterior border and posterior border both are mirror images. Okay. So next we are coming for medial border. So medial border of radius, it is short border, and it gives connection for interosseous membrane, so that it is called as interosseous border. Okay. So next we are coming for surfaces. So there are again three surfaces. What are the three surfaces? Anterior surface, posterior surface, and lateral surface. You should keep this thing in your mind. That is, radius bone is a lateral side bone, and so it has a lateral surface. When you say ulnar bone is a medial side bone, so it should have a medial surface. Okay. So lateral side bone has lateral surface, medial side bone has medial surface. Okay. So now we are coming for the surfaces. Anterior surface, the upper two-third, lower part. Okay. So anterior surface, upper two-third, and low. We are dividing these thing because of the muscle attachment. Okay. So next we are coming for posterior surface. Again, divided into upper part and lower part. And lateral surface is divided into upper part, middle part, and lower part. So now we are coming for the muscle attachment. So tuberosity, it gives attachment for biceps brachii, and anterior border, anterior oblique line, and the vertical lower part, it gives origin for flexor digitorum superficialis. Okay, so tuberosity present in the upper end, it gives insertion for biceps brachii. Okay, so already we have seen biceps brachii has two heads. Okay, short head and long head. But insertion is single insertion, inserts in the radial tuberosity. Okay, it inserts in the rough part. So now we are coming for anterior border of the shaft. The upper part is anterior oblique line, lower part is vertical. Both the part, it gives origin for a muscle, flexor digitorum superficialis. So always please remember that whatever muscle in radius and ulna, it originates in the anterior part, it should be flexor muscles. Okay, so posterior part, it should be extensor muscle. So extensor muscle never comes in anterior surface, and flexor muscle never comes in the posterior surface. This is logic. Okay, so now we are coming for surfaces. Anterior surface, so upper two-third, it gives origin for flexor pollicis longus, and lower part of anterior surface, it gives insertion for a muscle called as pronator quadratus muscle. Okay, so it is a quadrangular shaped muscle. It's a very small muscle which connect both the radius and ulna. The name of the muscle is pronator quadratus. The insertion. Okay, so next we are coming for posterior surface of radius. So posterior surface of radius, it gives origin for two muscles above abductor pollicis longus and below extensor pollicis brevis. Okay, so abductor muscle and extensor muscle can come in the posterior surface. Abductor and extensor muscle never comes in the anterior surface. So next we are coming for lateral surface. So lateral surface, it gives. So sorry, here I have not written. So I'll say in oral. Upper part, it gives insertion for a muscle. Okay, so the first one is supinator muscle. Middle part, it gives insertion for a muscle called pronator teres. Lower part, it gives insertion for a muscle called as brachioradialis. Okay, lateral surface, it gives insertion for three muscles above, supinator, middle, pronator teres, lower part, brachioradialis. So now we are coming for lower end of radius. We can talk about features, external features. So lower end of radius, it is broader and has five surfaces: anterior surface, posterior surface, medial surface, lateral surface, and inferior surface. So there are five surfaces. Okay, so we can talk about anterior surface. Anterior surface has a thick ridge and it is crossed by a radial artery. So we are palpating the radial artery on this anterior surface of lower end of radius. Okay. Second one is posterior surface. So posterior surface has four grooves in it. Okay. So it contains four grooves in it. Okay. And what are the four grooves? This four grooves is for the passage of extensor tendon. And next one is medial surface. So medial surface, we have a ulnar notch. Medial surface, we have ulnar notch for the articulation of the ulna. Okay. And next one is lateral surface. Lateral surface, there is an elongated process called as styloid process. Inferior surface. Inferior surface has two areas. One is triangular area for articulation of scaphoid, and medial area is quadrangular for articulation of a lunate bone. Okay, so inferiorly, the radius will articulate with two carpal bones. One is scaphoid, other one is lunate. Okay, anterior surface, posterior surface, medial surface, lateral surface, inferior surface. So posterior surface, we saw there are four grooves, and along with that, it has one tubercle, dorsal tubercle of Lister. Okay, posterior surface has four groove and tubercle called as Lister. And muscle attachment, no muscle is attached to the lower end. So here you can see in this picture the radius. So the radius, you can see the upper part, that is this shaped head, and you can see constructed area in the neck, and you can see the radial tuberosity, and you can see the border, anterior border very clearly. Okay, the lower part, you can see styloid process, and you can see the articular surface for the scaphoid and lunate. So in this side, right side, you can see here again the parts of the radius. Posterior border can be seen clearly, lateral surface can be seen in this region, and ulnar notch can be seen here. Dorsal tubercle of Lister also can be seen. So please remember this term, that is radial bone, lateral side bone, and so it has a lateral border. Sorry, lateral surface. Okay. So ulnar bone, it is a medial side bone, so it should have a medial surface. Keep this in your mind. And this is again, so in this picture you can see the lateral surface attachment for three muscles, insertion of three muscles. So first one is supinator,